Hello guys, in this video, I'm going to share to you tips on passing NCLEX RN examination in 2020. So let's get started. Number 1, know your content. I am not saying that you should know everything. What I'm saying is you should know the must know in nursing. You should have a good grasp of the important concept. Because knowing your content is the key in answering the select all that apply. I've taken different examinations in nursing such as PNLE, Prometrics, HAAD, but NCLEX RN is totally different. This exam will find your weakness. It will give you questions in each topic and give you more questions on things that you are not familiar with. But of course, you can overcome them, guys, because I'm not saying that you should answer all the questions correctly for you to be able to be above the passing standard. But what you need to do is to be able to answer the easy questions and be able to reach the hard questions. Remember, you won't be able to reach the hard questions if you don't answer the easy questions correctly. On my next video, I'll discuss important topics per system that a new nurse should know. And these are key concepts in answering the NCLEX RN. You should not go there and take the test without knowing this, or else you will feel defeated. It is also nice to check the test plan of NCSBN on their website. So that website is ncsbn.org/testplans.htm. So you can see it. Number 2, practice answering questions as many as you can. This will help you ready on facing the NCLEX RN examination because you will enhance your skill in taking the test. Know the rationale in each questions that you have answered, regardless of whether you answered them correctly or not. But also remember that it will be better to answer questions if you already refresh yourself on the core content of nursing, especially those who have graduated from nursing school for a very long time, just like me. I graduated 10 years ago, but I was able to pass the NCLEX RN in 75 questions. So you can do it also, guys. Okay? So let's go to number 3. Try your best to understand what the question is asking. So what do I mean by that? Learn how to divide the question into 2 parts. First is knowing the situation. Second is knowing what the question is asking. So what I did when I took the test, I used the pen and paper that they gave me. I put there the topic of the question, and then like if their question is about medical surgical, pediatrics, OB/GYN, fundamentals, prioritization, delegation, etc. And then I'll make sure also to write the key on the question. So I'll give you example. The nurse provide health teaching to the client on the proper use of metered dose inhaler. What would the nurse need to follow up if the client state? So in this question, you will write on the paper like health teaching. So you are talking about health teaching on the proper use of metered dose inhaler, and the questions asking nurse need to follow up. So the word follow up means negative, so you need to get a negative answer from the choices. So what I did is I put negative on that paper. So number 1, I will rinse my mouth thoroughly with water after its use. And then number 2, I will shake the inhaler and hold it upright and press it once while inhaling. And then number 3, I will wash my hands before and after. And number 4, I will hold my breath for 10 seconds to allow the medication to reach deeply into my lungs. So as you can see here, what is the negative answer? Number 1 is correct. You need to rinse your mouth thoroughly with water after its use. Number 2, I will shake the inhaler and hold it upright. You shake the inhaler and you need to breathe out before you hold it upright, and then breathe in while pressing the metered dose, and you need to inhale slowly. So number 2 is the answer, because number 3 also, I will wash my hands before and after, is a positive answer. I will hold my breath for 10 seconds. That's correct also. That's positive answer. So the answer is I will shake the inhaler and hold it upright and press it once while inhaling. So this is a negative answer. So you need to follow up that to the client, that the client needs to exhale first before holding the metered dose in front of the client. So number 4, know a set of test-taking strategies. But make sure that the test-taking strategies that you will use is the one that best suits you and not confused you. And also remember, this is the last resort that you will use, especially if you don't know the answer. Because you should answer first using your knowledge of the concept, not with the use of test-taking strategies. And lastly, number 5, be confident and follow your instinct. Believe in yourself and in your instinct, because there is a bigger chance of you passing the test if you follow your instinct. So that's it, guys. Hope this helped, and please stay tuned on my YouTube channel for more videos on NCLEX RN. I'll be uploading soon the summary of my review materials, so see you guys at the comment section, and don't forget to subscribe on my channel. Thank you.